Hello everyone, my name is Mia Riemann, and today I'm going to be talking with you about heart failure for my population-based initiative in chronic illness presentation. Let's start by taking an overview looking into heart failure. Currently in the United States, there are about 5.7 million adults living with heart failure. It has been noted that there are about 550,000 new cases of heart failure diagnosed each year. Heart failure is the most common reason for hospitalization in patients over the age of 65 years old. Unfortunately, this condition has a high mortality rate, and according to the Centers for Disease Control and Prevention, in 2009, 1 in 9 people died with heart failure, being a contributing factor. Overall, about 1/2 of people die within 5 years of receiving the diagnosis of heart failure. So what is heart failure? Heart failure is a pumping problem. According to Kopsed and Banasic, heart failure is a condition where the heart does not have the ability to maintain sufficient cardiac output to meet the body's needs, and it is identified as the end stage of most cardiac diseases. We'll be looking at the primary, secondary, and tertiary prevention strategies for heart failure. A brief review of the different types of prevention. Primary prevention looks at avoiding exposure to a disease-causing agent. Secondary prevention looks at limiting risk and detecting disease that when exposure has occurred. And finally, tertiary prevention is the reduction of the disease's effects once the patient is experiencing symptoms of the disease and the disease is present. First, it is important to prevent heart failure from occurring for all patients. Therefore, primary prevention is essential. Currently, for primary prevention of heart failure, it is important to maintain a healthy weight. Studies have shown a linear relationship between heart failure and a body mass index greater than 30, and new research is identifying the correlation of heart failure and body mass index in the overweight category between 25 and 29.9. Therefore, weight control is the first step towards heart failure prevention. Next, it is important to support smoking cessation. According to Butler, smoking is a strong predictor of heart failure in both men and women. With an increased risk, they gave a percentage of about 45 to 88%, which is a wide range, but there is a correlation. Exercise is the next primary prevention strategy. The American Heart Association recommends aerobic activity and muscle strengthening activities regularly. Next is through diet. One diet recommended for cardiac patients is the DASH diet, which encourages patients to eat more fruits, vegetables, lean meats, fish, and poultry, low-fat dairy products, as well as seeds and legumes. The DASH diet also recommends low red meat, low sugar intake, low fat intake, and low sodium intake. Finally, it's important for these patients to control risk factors and other comorbidities. So if they have coronary artery disease, diabetes, sleep apnea, obesity, and hypertension, it's really important to keep these patients monitoring their other conditions as well. Next, we will look at secondary prevention. Secondary prevention looks at what we do after the patient has been exposed to the disease. Once the patient has been diagnosed with heart failure, it's essential to identify the stage of their condition as well as identifying their heart function. This will then provide a path to appropriate medical treatments with medications such as diuretic, ACE inhibitors, beta blockers, vasodilators such as nitro, and even positive inotropes such as digoxin. This is just as important to provide appropriate education regarding this condition. This would include educating the patient on lifestyle modifications such as weight loss, diet, exercise, and comorbidity control. The education would also cover the importance of weight management. According to Regalbuto, Maurer, Chappell, Mendez, and Schaefer, due to the complexity of this condition of heart failure, it's imperative that patients understand their medications, the importance of lifestyle modifications and weight management to reduce the risk of their 30-day readmission rates and overall health. Tertiary prevention for heart failure looks at the reduction of disease symptoms. So when I think of tertiary prevention, it's essential to reduce heart failure exacerbations. This again is through comprehensive education regarding medications, lifestyle modifications, as well as weight management. This could also be providing information to connect with support groups and just make sure that the patient is overall well supported This is a very difficult and complex disease to manage. Therefore, holistic care is essential to ensure success for these patients. So health policy-wise, currently the Joint Commission has taken steps to ensure that all patients with heart failure have adequate medication, treatment, and education. Yet, due to the complexity of the condition and the education needs to be really comprehensive as well as in-depth to continue to keep patients with high quality of life as well as out of the hospital. Due to the requirements of the Joint Commission to ensure that there is education provided, there is still an inconsistency between facilities. In some facilities, there are heart failure teams which have been implemented which provide comprehensive heart failure education, tips on diet and weight management, sodium monitoring tools, and some places even give patients scales to ensure that the patient has a firm grasp on understanding and is able to weigh themselves and just monitor this complex condition at home. Other places, they do not give as much education, and sometimes patients are left with only a handout. So it's important to ensure that these patients are given in-depth education consistently, and unfortunately that inconsistency exists. With the implementation of comprehensive education, it has been shown that teaching patients to monitor their own condition and understand when to call for medical assistance can reduce mortality as well as hospital admissions, as well as improve the patient's quality of life and keep them a little bit more independent. The implementation of health policy, the core measures in the Joint Commissions is holding medical providers and hospitals to maintain high quality care through evidence-based practice. Education-wise, education for heart failure, patients should include in-depth discussion regarding what heart failure is. Patients should have a full understanding of the complexity of the condition as well as the prognosis. It may be difficult to explain the statistics regarding heart failure, but with appropriate lifestyle modifications, monitoring weight, fluid restrictions, salt consumption, and diet, patients should be able to stay out of the hospital and attempt to live high-quality lives. Finally, the psychological impact of heart failure is hard. With full understanding surrounding the complexity of this condition, as well as the prognosis of the diagnosis, patients may feel lost, hopeless, they may feel depression, fear, anxiety. They may have lost some independence from where they were previously, so there is some frustration with that. And there are many other mixed emotions with just such a complex diagnosis. Therefore, it's important for healthcare providers to understand the importance of holistic care. It's really important to empower these patients and give them hope and courage to work towards healthy choices, finding support, and overall disease management. With finding support, we can encourage socialization to reduce the feelings of isolations, and many communities have support groups where heart failure patients can meet and support one another. So, summarizing heart failure, these patients have a very complex disease that requires in-depth and comprehensive education, understanding, and rigorous management. These patients are at risk for psychological distress related to the complexity of their condition and prognosis. Yet with adequate support, information, and management, these patients can continue to maintain a quality of life and reduce hospital admissions. Thank you all for listening to my presentation, and here are my references.